Who is Hildegard Elizabeth Peplau? Born on September 1, 1909 and died on March 17, 1999. Was an American nurse who is the only one who served the American Nurses Association, ANA, as executive director and later as a president. She became the first theorist since Florence Nightingale. Peplau was well known for her theory of interpersonal relations, which helped to revolutionize nurses' scholarly work. She served in the Army Nurse Corps, was assigned to the 312th Field Station Hospital from 1943 to 1945, where the American School of Military Psychiatry was located. She met and worked with all the leading figures in British and American psychiatry. After the war, they worked to reshape the mental health system in the United States through passage of the Mental Health Act of 1946. Peplau was certified psychoanalysis by the William Alanson White Institute of New York City. In early 1950s, she developed taught the first classes of graduate psychiatric nursing students at Teachers College. She also a member of the College of Nursing faculty at Rutgers University from 1954 until her retirement in 1974. In addition, Hildegard Peplau is founder of Modern Psychiatric Nursing, an innovative director, advocate for mentally ill, proponent of advanced education for nurses, executive director and president of ANA.
What is interpersonal relations theory? Describes the importance of the nurse-patient relationship as a significant, therapeutic interpersonal process, and is recognized as the first nursing textbook since Florence Nightingale's work in the 1850s. She discussed 4 psychobiological experiences that compel destructive or constructive patient responses, as follows: needs, frustrations, conflicts, and anxiety. Peplau identified 4 phases of the nurse-patient relationship: orientation, identification, exploitation, and resolution. Major concepts of the theory. 1. The theory explains the purpose of nursing is to help others identify their felt difficulties. 2. Nurses should apply principles of human relations to the problems that arise at all levels of experience. 3. Peplau's theory explains the phases of interpersonal process, roles in nursing situations and methods for studying nursing as an interpersonal process. 4. Nursing is therapeutic in that it is a healing art, assisting an individual who is sick or in need of health care. 5. Nursing is an interpersonal process because it involves interaction between 2 or more individuals with a common goal. 6. The attainment of goal is achieved through the use of a series of steps following a series of pattern. 7. The nurse and patient work together so both become mature and knowledgeable in the process. Assumptions. According to Gonzalo, 2021, Hildegard Peplau's interpersonal relations theory's assumptions are: 1. Nurse and patient can interact. 2. Peplau emphasized that both the patient and nurse mature as the result of the therapeutic interaction. 3. Communication and interviewing skills remain fundamental nursing tools. 4. Peplau believed that nurses must clearly understand themselves to promote their clients' growth and avoid limiting their choices to those that nurse value.
According to Markowitz and Weissman, 2012. The matter of the brain has taken precedence over theoretical abstractions about the mind. Therapeutic interventions that target thoughts about self and the world are emphasized over emotions and relationship issues. Interpersonal therapy does remain a viable form of psychotherapy. But in response to valid critiques that the mid-century relationship formulations needed more empirical rigor and research, today's interpersonal therapies are formally scripted, standardized, focused and time-limited models that require training and advanced education and lie within the domain of carefully trained specialists. The following are the roles of the nurse in the therapeutic relationship identified by Peplau. Stranger, offering the client the same acceptance and courtesy that the nurse would to any stranger. Resource person, providing specific answers to questions within a larger context. Teacher, helping the client to learn formally and informally. Leader, offering direction to the client or group. Surrogate, serving as a substitute for another such as a parent or a sibling. Counselor, promoting experiences leading to health for the client such as expression of feelings. Technical expert, providing physical care for the patient and operates equipment. Mr. Black is a 63-year-old man who presents to the clinic with complaints of constant hunger, urinating a lot, and having blurred vision. He expressed concern that he has been losing weight but he does not know why. Mr. Black appears to be lethargic and obese. He said that he is still working and drives to different provinces delivering food as a truck driver. He stops along the way to buy fast food or gas station meals and soda pops. Mr. Black voiced concerns that he lives alone and is sometimes lonely. He also states that he is a regular smoker and drinks alcohol. He said that he thinks his doctor told him that he is a newly diagnosed diabetic, but he does not know what that means. He is anxious and fearful about living alone with this new disease and if his ability to work and engage in normal activities will be affected. He is requesting information about diabetes.
Hi, my name is Angela. I am your nurse today. May I know your name? How would you like me to address you?
My name is Alan Black. You can call me Mr. Black.
What brings you to the clinic today?
I am not feeling well since few weeks. I am feeling tired, and my appetite has been increased than before. I also feel so thirsty, and I urinate more frequently. I am also experiencing lethargic, and I think I have also lost some weight.
Okay, Mr. Black. Now I am going to collect some of your health information. Is that okay with you?
Sure.
Now I am going to check your vital signs and I am going to check your weight also. Is it okay for you? The doctor will see you shortly.
Thank you.
Orientation phase. Problem, defining phase. Starts when client meets nurse as a stranger. Defining problem and deciding type of service needed. Client seeks assistance, conveys need, asks questions, shares preconceptions and expectations of past experiences. Nurses responds, explains roles to client, helps to identify problems and to use available resources and services.
Your vital signs are within normal range and your weight is 230 pounds.
Hello again, Mr. Black. Your doctor has ordered some lab tests for you. I can take samples now.
Okay. For how long before we get the result of this test?
It will be ready within a week or so. We will give you a call when the results are ready.
This sounds good. Thank you so much.
Now let's take a look at the factors influencing orientation phase. As we see, the same factors influence a nurse and a patient in their relationships such as values, culture, race, beliefs, past experiences, and expectations, except the nurse is also influenced by preconceived ideas. Hello, Mr. Black, it's been almost a week. How are you doing today?
Nothing has changed much.
I am sorry to hear that. We've got the result of your test and the doctor is ready for you. And I will see you after.
Thank you.
A few moments later.
I hope everything went well with the doctor.
The doctor told me that I have diabetes. I don't know anything about diabetes.
Mr. Black, I know that you are newly diagnosed with diabetes mellitus. Are there any questions you would like to know about the condition?
Yes, I don't know anything about this disease. I heard that I will have to take injections and eat differently. I am scared to go home and be all by myself. Can you tell me anything about it?
Oh yes, Mr. Black, you would need to make a few adjustments to your lifestyle. Do you usually like reading?
Yes.
That is great. I will provide you with some brochures so you can read up more on the condition, signs and symptoms, medications, etc. It is yours to take when you are discharged, so you can remember how to stay safe at home. It is okay to ask me any other questions or share your concerns. Lack of knowledge/fear of discharge. The primary goal of clients identified by peplau 1991 is the need for feeling of satisfaction and security. Conflicting goals is a common barrier in the effective nurse-patient interpersonal relationship. This is most commonly seen when the patient wants to go home yet they are fearful of leaving the perceived safety of the hospital. This may be due to the client not having sufficient knowledge about their disease process, treatment, and self-care. Peplau advises that nurses can act as a resource person by being therapeutic and providing accurate, relevant information and experiences so clients can overcome this fear. Before discharge, patient will demonstrate knowledge of insulin injections, symptoms and treatment of hypoglycemia and diet. Nursing diagnosis deficient knowledge related to unfamiliarity with information as evidenced by fear of discharge, statements of concern and request of information. Good evening, Mr. Brown. I heard that you have a concern about your sudden weight loss.
Yes, I don't understand why this is happening to me. I want to know the correct foods to eat so that I can feel better.
I appreciate your concern. I will show you the foods to select to prepare a healthy meal suitable for diabetics for one day. Then we will work together to do meal planning for the week, so that you can have the knowledge about the selection of suitable foods. We will also weigh you at the same time every day until you are discharged. If you have a scale at home, you can monitor your weight also. Problem: unstable environment. Peplau considered the environment as a milieu where nurses create an atmosphere conducive to recovery. Peplau, 1952, further argued that the leadership role involves collaboration between the nurse and the client to meet desired treatment goals. The nurse offers guidance, direction, and support to promote the client's active participation in maintaining his or her health. The goal of the nurse is to help the client accept increased responsibility for the plan of care. At the end of the leadership sessions, the client will demonstrate the ingestion of the necessary nutrients, while his weight measurements and laboratory values will become stabilized. Nursing diagnosis: imbalanced nutrition, less than body requirements related to decreased oral intake as evidenced by increased urinary output, poor food intake, recent weight loss and increased ketones. According to Peplau's theory, the identification phase recognizes the collaborative efforts of the nurse and patient working together, thereby building understanding, trust, and acceptance as the patient is an active participant in treatment. In Peplau's theory, the focus is on interdependent goal setting between the nurse and client. Therefore, the following are some important goals and nursing care plans that can be used to care for our client. Hello, Mr. Black. How are you feeling today? Do you have any concerns that you want us to discuss?
I am feeling anxious about not being able to go back to work. Can I still do all my day-to-day activities, even though I was just told that I have diabetes?
Oh yes, if you follow the guidelines outlined by the medical team and if your doctor does not give any restrictions, you will be safe to return to your regular duties and activities. I will support you through this process. Problem: anxiety. Peplau referred to anxiety as unexplained discomfort which can occur when there are unmet needs, obstacle to goals, or conflicting goals. Anxiety may be associated with issues such as guilt, doubt, and fears. Peplau advised that the nurse may act in the counselor role to help allay fears and anxiety. The nurse would be responsible for encouraging the client to explore his current situation and problems. The nurse must be aware that such exploration often engenders anxiety and therefore must facilitate an atmosphere that is conducive for the client to explore his or her concerns. In this case, the client is concerned about his ability to still engage in activities of daily living and if he can continue to be gainfully employed with his trucking job. Patient will demonstrate the ability to explore his problems and seek appropriate self-supporting activities that will help him to overcome anxieties about his abilities to work and engage in normal activities. Nursing diagnoses anxiety related to loss of control as evidenced by patient verbalizing that he does not know if he can still do trucking work or take part in his normal activities with this disease. Exploitation phase. The client makes full use of the services offered. Use of professional assistance for problem-solving alternatives. Advantages of services are used based on the needs and interests of the patients. The individual feels like an integral part of the helping environment. The principles of interview techniques must be used to explore, understand, and adequately deal with the underlying problem. Before you leave, I want to ask you, how are you feeling about dealing with all of this?
If I'm being honest with you, I'm overwhelmed and stressed and I'm not sure if I could manage all of this.
I may suggest that you must start your medications, including insulin injections and tablets, that be taken on time. I will also teach you on how to use the glucometer and how to check your blood glucose at home. I will also suggest that you must stop or quit smoking and alcohol consumption, and I also suggest that eat fiber-rich diet and cut off sugary and oily food.
Thank you so much.
A diabetic patient needs some more precautions to control glucose levels in the blood. This patient has some complications like obesity, and he is alcohol addicted and a smoker too. Explain to the patient to take medication on time as prescribed by the physician. The patient does not have family, and he is struggling with emotional stress. The nurse can educate patients to socialize with other people. Speaker: the final phase is the resolution phase. Client no longer needs professional services and gives up dependent behavior. The relationship ends. The patient's needs have already been met by the collaborative effect of the patient and nurse. Now they need to terminate their therapeutic relationship and dissolves the links between them. Resolution phase. The client no longer needs professional services and gives up dependent behavior. The relationship ends. Termination of professional relationship. The patient's needs have been met by the collaborative effect of patient and nurse. Now they need to terminate their relationship and dissolve the links between them. In our case scenario, patient is very much satisfied as his goals has been achieved. His blood sugar level is under control. He made changes in his lifestyle by eating more healthy food and doing exercise on regular basis. Maintaining his ideal weight, he is not feeling tired and lethargic in a day. Symptoms of polyuria has been reduced. He's getting much better sleep, following his medication regime strictly. He just needs follow-up with blood work after 3 months. This is also the time has come to end the therapeutic relationship between the nurse and the patient.
Conclusion: Peplau's theory helps nurses to provide individualistic and therapeutic care to client and their families. It also helps the client develop theoretical skills and knowledge about disease processes and self-care. In our case scenario, the patient is very much satisfied as his goals has been achieved. His blood sugar level is under control. He made changes in his lifestyle by eating more healthy food and doing exercise on a regular basis. Maintaining his ideal weight, he is not feeling tired and lethargic in a day. Symptoms of polyuria has been reduced. He's getting much better sleep, following his medication regime strictly. He just needs follow-up with blood work after 3 months. This is also the time has come to end the therapeutic relationship between the nurse and the patient.